Hi guys, we're now in our part 3 of our patient today having multiple combination laser and radiofrequency treatment. We're now using our favorite pigmentation reducing laser. This is what's called a low level, low density laser. What that means is every skin type can use it and it doesn't have a lot of downtime. We're using the clear and brilliant laser or the Primea handpiece, which is a blue handpiece. You see right here, it's a 1927 wavelength diode that's used to lift pigment, basically. This was originally designed for two things. One, to lift pigmentation, and two, to push products into the skin. That's why it's called permea or permeation, to push things into the skin. So it's creating little channels in the skin that will allow absorption of nutrients, like we're gonna put on PRP, which is growth factors from our own blood. You can see that right here. We've already pre-drawn those growth factors. We're gonna put those on right after we do the laser with microneedling to literally push the products into her skin so we get a lot more improvement in the sun damage, if there were laser burns, pigmentation, etc. Shrinks pores. People love this when they're younger for aging prevention and fine line reduction. People love this when they're older because they don't want to have a lot of downtime, and this just reduces sun damage. And this wavelength has been shown to significantly decrease the rates of skin cancer producing cells. So overall, we love this treatment because it's very light, it can be used frequently, has minimal downtime. I do this every 4 to 6 weeks. If you take a close look, take a look at these pores. Do you see many? Do you see any pores? Any pores?
Hardly.
Barely any pores, because we're doing the clear and brilliance regularly. And at home I do micro rolling, skincare. There's a lot of stuff we're doing. So this combination for her today with the microneedling energy to tighten the skin and the laser for pigments and give her a really nice improvement.
How long do you do this laser?
How long does it take to do?
No, how long do you do it? I mean, how often do you do it?
I do it every 3 to 6 weeks.
Oh, wow.
Been doing it for 3 years.
Yeah.
I haven't aged, except for my dark circles starting to form because of stress. We gotta get some fillers injected, but that's a whole nother level of aging, right? Texture, color, and tone is its own thing, and that's skincare, peels, facials, microneedling, and lasers. That's what we use for that. But when it comes to sagging and volume and wrinkles, we need to address the volume and the lifting component. So these are very different signs of aging. Here we're focusing on texture and some fine wrinkling improvement. You can see up close, I got an electrical scanner. So this is rolling. As it rolls, it delivers homogeneous energy. You can actually hear popcorning. Do you hear that? The popcorning? That's because it's so superficial and the dehydrated cells are popcorning on the surface. So she'll have a sandpaper-like texture on her skin for the next few days, and our treatments for that is vitamin B, vitamin C, enzymatic exfoliation, and something called dermal repair and ATP. Both work to replenish the dehydration that occurs in the cells and to allow your cells to heal better. If you just put an occlusive on top, like a Vaseline or a thick ointment, it gets really hot and actually damages cells. It's actually been shown to be better to be doing growth factors and serums after lasers rather than occlusive ointments. So that's clear and brilliant. Anyone asking anything else? No? All right.
All right.
Perfect.
Cool.